This is Dr. John Whitcomb talking about the bradykinin hypothesis for COVID. I actually enter this topic, it's a little arcane, but I thought it might make sense when you see the bigger picture. What the folks did is looking at folks with COVID is they looked at the activated RNA in their blood. And what they found was there were dramatic increases in genes related to the bradykinin angiotensin system, like 300-fold increase in messenger RNA. Now, angiotensin raises your blood pressure, which is why you take an ACE inhibitor, but angiotensin balances with bradykinin, and bradykinin lowers your blood pressure, makes your blood vessels ooze and all that kind of stuff. Well, the net effect is if you have COVID in your lungs, and I take your lungs out at autopsy, they're going to weigh 4 times as much as they should because they're soaking wet and they've oozed out fluid into the tissue. But that's not the point here. The point is that we're learning to measure the genes that are activated and express the disease. And what we're finding, which is totally fascinating, is that in COVID, the folks who have long-haul symptoms, who are desperately sick for months and months and months, are a select few who are the same category of people who get mold disease in a moldy home. You can check your own vulnerability. You can see who's more vulnerable to mold, and you can tell if you are going to be vulnerable to long-hauling disease by ordering an HLA-DR test off of Life Extension. .com. It goes to LabCorp and they'll measure it for you. And go to Shoemaker's website, www.survivingmold, and you can see the intersection. Well, Shoemaker in the mold universe has now developed the Genie test, which also measures messenger RNA circulating around your body to tell you what your body is saying is activating. This study on COVID shows the exact same process. This is the future of medicine. Instead of going to a doctor who guesses, we'll measure your activated messenger RNA in your exosomes and tell you what your disease is. This is Dr. John Whitcomb talking about the bradykinin hypothesis of COVID.